Hello and welcome to WAVE Clinical Support. From your case, I understand you have a patient who's previously worn bifocal gas permeable contact lenses. With your current WAVE designs, I understand you're experiencing some unexpected cylindrical overrefraction, inconsistent refractive data, and some blurred vision. I also understand you lost all your data for the left eye. Don't get discouraged, that's happened to all of us. Hopefully I can offer a few tips to help you get back on track. Let's first look at this right eye, the topography. Couple general observations. The first thing I notice is you've got a little bit of a ridge down here in the bottom part of the cornea. That suggests to me that this patient's previous lenses were probably riding a little bit high, maybe causing a little warping in the cornea. In my experience, it's best if you can have these patients stay out of their previous lenses for 3 to 5 days or longer if possible. Unfortunately, that's not always clinically practical in the contact lens world, but I find it useful sometimes to ask them to maybe stay out of their lenses over the weekend, maybe Saturday or Sunday, and come in first thing on a Monday morning before they put their lenses in for fresh topographies and refraction. I found that that goes a long way into helping these lenses become more successful. With that said, quite often, as you know, we have to work with what we have to work with. So let's take a look a little closer at these designs. If we look at your current design, I notice you chose G-SIM. I agree with that. With a cornea that has a little bit of warping in it, I think the G-SIM has a better chance of keeping that lens centered on the eye. When I look at your back surface here, I notice you have quite a bit of an edge standoff. I generally like to see this lens stay a little bit more in alignment with the green line. With this lens, if we follow it all the way around the meridians, it suggests that it's a little on the flatter side. I would be concerned that this lens might be doing a little rocking on the cornea. That can give you a little inconsistency with your overrefractions. If we look over here, if we switch this over to RSIM, that'll kind of give us the spherical equivalent of the lens design that you have. And you'll notice this base curve is at 733. The prior lens the patient was wearing was about a 718. So once again, it's a little bit flatter than what they've been wearing. So if we go back here to the G-SIM, again, we're going to try to get this line a little bit more in alignment here. If we also look at the thickness of this lens, it's at a 15. That sometimes might be a little bit thinner on a lens like this. You might get a little bit more flexure on that. We'll talk about that in a moment. And so with this lens, I'd be concerned that we might have a little difficulty keeping this distance zone lined up, which might contribute to some of the blurring. So let's take a little closer at this look at the design. If we talk about the diameter of the lens, general rule of thumb, if your patient's been wearing a previous lens, we try to keep changes no more than 1/2 to 1 millimeter larger. So the 10.1 is actually an okay size. If this lens was comfortable for the patient, that's okay for you to stay at that point. I would probably personally start at about 10.0, and I would probably arbitrarily set this at about a 6 and a 7. A lot of fellow WAVE designers have found that this is kind of a nice place to start, and I agree, it tends to give a nice consistent performance. Let's let the WAVE system do some designing for us. And you'll see once this lens is laid down, we have a lens that's very nicely in a line. If we follow this all the way around, you'll see that lens now matches the green line almost perfectly. This lens I would expect it to align more consistently, probably stay centered a little bit more consistently also. I want to make sure we get enough edge lift on this lens so we don't have adherence. Probably might be around 2 or 3, get this up a little bit higher. And now I get a lens that should sit very nicely on that eye. Good. Next, if we look at the thickness, I mentioned that this may be a little on the thinner side. At the 15 that it originally was, I'd probably bump this up closer to maybe 21 or so to start. That really won't change any difference in the comfort, but what that'll help reduce is any tendency toward flexure on that lens. If we look at your pupil size, I think this is reasonable. You went pupil about a 2.85, and you went about 0.3 larger. As kind of a general rule of thumb, I tend to start off with the distance eye approximately 1/2 to 1 millimeter larger, and the non-dominant eye, if you will, about a 1/2 millimeter. But this is actually not too bad. I think with the lens a little bit more aligned, I think you'll got a pretty good chance of keeping that centered. Depending which eye this was, if it was the dominant or non-dominant eye, you may want to adjust that a little bit. When it comes to cylinder over refraction, again, I suspect that most of that is probably related to flexures, since their previous spherical lenses did not have a cylinder over refraction. So I would expect this lens to perform very nicely. Now, a couple things: if you do get into a little difficulty with this lens design, you could always go back to our initial suggestion of maybe staying out of the lens for a few days and repeating the topographies and refraction. That'll help clarify your question about the cylinder over refraction, or the cylinder post refraction that you're receiving. Or there's a really neat tool, I don't know if you've discovered it yet, but if you go down here to trial lens data, this is a great little tool. I like to take patients and place a known spherical lens of known parameters, place it in the eye, and get a nice clean refraction over the top of that, and include that. And I do that with all my lens designs, all my wave designs. I found that it goes a long way to getting these lenses to perform properly on the eye. With that said, I think this design would work really well. From the left eye, unfortunately I lost the data, but what you can do is use your new topographies, design a lens based on some of these similar principles, and maybe use that nice tool that we talked about here, and using some of their old data from their old contact lens. Place that in here, and that at least should get you a lens that should perform reasonably well out of the gates, making sure you keep that center thickness thick enough. Very good, and that should do it. Well, I wish you well with your wave lenses, and I hope you find this helpful. Have a great day. Thank you.